Hello, I am Dr. Shimizu from Nippon Medical School. In this study, we retrospectively analyzed adults who underwent post-bronchodilator spirometry, identifying patients with preserved ratio impaired spirometry, PRISM prism, and those with gold stage 1 COPD. Impulse oscillometry data were available for a subset, and longitudinal analysis focused on carefully defined trackable cohort. PRISM is a heterogeneous condition, and its physiological relationship to early COPD remains unclear because spirometry alone may not fully capture airway mechanics. Additional physiological assessment may be informative. In cross-sectional comparisons within the trackable subset, patients with non-restrictive prism showed greater peripheral airway abnormalities on impulse oscillometry than those with gold stage 1 COPD. This pattern was observed at both the initial and final assessments, despite relatively preserved spirometric indices. In contrast, spirometric indices showed less consistent separation between groups across the two time points, highlighting the limited ability of spirometry alone to characterize non-restrictive prism. Together, these findings suggest that impulse oscillometry can detect physiological abnormalities not captured by spirometry, and that prism represents a physiologically heterogeneous condition. Analysis across the two assessments showed substantial inter-individual variability and were exploratory in nature. In conclusion, PRISM showed respiratory mechanical patterns that differed from early COPD, despite partially overlapping spirometric profiles. Impulse oscillometry suggested possible peripheral airway involvements and may complement spirometry in characterizing this heterogeneous condition. However, given the exploratory nature of this study, these findings should be interpreted cautiously and considered hypothesis generating. Larger prospective studies are needed to clarify their clinical significance. Thank you for watching.